Hello, please subscribe and like for our channel. Thanks very much. Hello, welcome to this new short case tutorial. So in this tutorial, we're going to see you have a patient, a 14-year-old boy that presents to the emergency department with 24-hour history of increasing abdominal pain. The pain is localized in the right iliac fossa and a diagnosis of acute appendicitis is made. At the operation, the appendix was found to be normal, and the abnormality shown in this patient in this figure was found at the small bowel. So the question is, what is the diagnosis? So we need to know that this diagnosis is called Merkel diverticulitis. I did not say Merkel diverticulum. No. Merkel diverticulitis, that's the inflammation of the Merkel diverticulum, presents similarly to appendicitis. Is it clear? So Merkel diverticulitis presents similarly to appendicitis. Are you understanding? So in this case, you have Merkel diverticulitis. Now they are asking you, what are the characteristics of this abnormality? The abnormality now is Merkel diverticulum. What is the characteristic of Merkel diverticulum? You have to know that generally, the characteristic of Merkel diverticulum are the rules of 2. Is it clear? Then generally, it is 2 feet away from the ileocecal valve. 2 feet corresponds, 1 feet corresponds to 30 centimeters. So 2 feet corresponds to 60 centimeters away from the ileocecal valve. Is it clear? Generally, it is 2 inch in distance. So is it clear? So the Merkel diverticuli is 2 inch in distance. Is it clear? So it is 2 inch in length. 2 inch in length, 1 inch corresponds to 2.5 centimeters. So generally it corresponds to 5 centimeters in length. So it's 2 inch in length. Is it clear? It's present in 2% of the population. Is it clear? It is present in 2% of population, and it is 2 times more in females than in males. Is it clear? So those are the characteristics of a Merkel diverticulum, and it's also a half of it is symptomatic. 50% of patient that has the Merkel diverticuli are going to be symptomatic. 50% of patients are symptomatic. So generally, those are the different things that you are going to have for the characteristic of Merkel diverticulum. Now, how can it present Merkel diverticulum? Now, for you to know the presentation of Merkel diverticulum, you must know that what the Merkel diverticulum is. It's a true diverticulum, because you need to know that there are what is called false diverticulum and true diverticulum. Is it clear? A diverticulum is first defined as an outpoaching of the lumen. Is it clear? Outpoaching of the lumen of the intestinal tract. Is it clear? When you have an outpoaching of the lumen of the intestinal tract, it's called a diverticulum. Now, a diverticulum that is a true diverticulum is when that outpoaching contains all the wall of the gastrointestinal tract. Is it clear? When it contains all the wall of the gastrointestinal tract, it is a true diverticulum. And Merkel diverticulum is one of true diverticulum. We have other diverticulum like ileal diverticulum. They are also true diverticuli. Is it clear? Now, in the case of false diverticuli, there is outpoaching of just the mucosa without the other portions of the wall, because the wall of the gastrointestinal tract is made up of the mucosa, the submucosa, the muscularis mucosa, and the serosa. If it's just made up of the mucosa, the submucosa, it is a false diverticuli. And in the case of colonic diverticuli, when you're in old age, those are false diverticuli. Is it clear? So how does this present? It's a true diverticuli made up of many tissue types. Is it clear? You need to know that what Merkel diverticulum has gastric tissues. Is it clear? Merkel diverticulum has small intestinal tissues. Is it clear? Small intestine tissues. Merkel diverticulum have colonic tissues. Is it clear? So that's why it can present with gastritis pain. Is it clear? So those heartburns. Is it clear? So it can present with epigastric pain that is burning in character, or periumbilical pain that is burning in character. That's one presentation. Is it clear? Another presentation It can present with it can present with signs of intestinal obstruction. Is it clear? It can present signs of intestinal obstruction provided there is band formation at that level. Is it clear? Resulting to rotation or twisting of the intestine. Is it clear? So it can present signs of intestinal obstruction like colicky abdominal pain, constipation, abdominal distension, vomiting. Is it clear? So those are the different things that can present. It can present like acute appendicitis. Is it clear? It can present like acute appendicitis, that's a periumbilical pain, is it clear? Or a right iliac fossa pain. Is it clear? It can present as acute appendicitis because it is 5 cm in length, and 5 cm in length can make it touch the parietal peritoneum. Is it clear? So it can also present like acute appendicitis, like in this patient. Is it clear? So those are the different presentations that you can have in this case. You can also present like upper gastrointestinal bleeding. Is it clear? Because that's why you have to know that what Merkel diverticulum can present with a brownish color stool because of upper gastrointestinal bleeding. Is it clear? So those are the different things that you have to note in mind. Is it clear? So those are Merkel diverticulum signs. So how will you deal with it intraoperatively? Is it clear? Intraoperatively, when you want to resect the Merkel diverticulum, you must make sure that you resect with all the tissues of the Merkel diverticulum, all the ectopic tissues. Is it clear? So I've told you that the Merkel diverticulum is made up of the gastric tissue, it's made up of intestinal tissue, it's made up of the large intestinal tissues. You should resect all of them. And generally, this tissue feel indurated, meaning that it feels hard. When you touch at those tissues, they feel hard. So when you resect the Merkel diverticulum tissues, you must try to feel so that you feel a distinction between the Merkel diverticulum tissue that is hard and the normal intestinal tissue that is soft. Is it clear? So you must remove all of them to prevent the recrudescence of symptoms or the remittance of symptoms. So that is all this tutorial of the Merkel diverticulum. So we continue with the next.
Hello, purchase your book, medical book, health science book, physics book, computer science book, all from us on 652-659429, and please don't forget to like and subscribe for our 2 channels, Science Video Makers and SchrDbb. Let me say the number again, 65699429. That is a place where you're going to have all these books. As you can see, we have the computer science book, which is shown in this image. You can see this is all the example of the computer science book, all inside. You have all this. We have the medical book for the first year, second year, third year, all available with all the explanation and questions. We have the physical examination book with all the step-by-step physical examination. This is the workbook for medical third year. The workbook for medical third year. This is the first year workbook. This is the second year workbook. As you can see, this is the second year textbook. All this we have on the no contact 652-659429. Thanks very much.